As healthcare providers, our principal duties is to do no harm, and we are bound to make the health of athletes our priority. It is according to the IFSPT competencies manual and the IOC sports medical manual, healthcare providers should possess the necessary education, training, and experience in sports medicine. They should possess the latest medical knowledge, be it you're a specialist, MD, a general practitioner, a sports PT, a sports and exercise medicine specialist. There is training available, IOC academic programs in sports medicine and sports physiotherapists. We are duty bound to maintain and upskill ourselves in order to provide the best care for our athletes. In chapter 2 of the OMMC, we look at, or the IOC looks at protection and promotion of athletes' health during training and competition. I have up here one of the new and exciting areas that the IOC has been very serious about educating us as sports medicine and healthcare providers, and that is the safeguarding in sports, safeguarding of our athletes. I have them on screen, and I'm inviting everybody to copy the URL codes. There is free certification in safeguarding in sports on the e-learning website of World Athletics. For persons who are so inclined, there is also an IOC safeguarding toolkit that can be downloaded from the website. And there's also IOC safeguarding in sports, the consensus statement. This is available at www.olympics.com/IOC/safe-sport. They want to get consensus to protect our athletes, to protect our children, to protect our adolescents, and even to protect practitioners involved in sports. As a matter of fact, the entire entourage can be safeguarded because abuse and harassment takes place from top to bottom, both in admin as well as to the athletes level. But here are two sites that I think will be beneficial to us as sports medicine practitioners. Fitness to participate in sports. Again, we are limited in the amount of information that we should give. Already underscore that we must have the athletes' consent to disclose. The healthcare practitioner should clarify their rights in relation with clubs, IFCs, LOCs, and sports organizers as it pertains to your responsibility to that third party, but more so to the athlete. You do not have to go into detail to let the club, the coach, or the organizers know whether the athlete is fit for return to sports or fit for participation. So as much as possible, you are basically not delivering a certificate on the fitness to play, but on the absence of contradictions to train or to compete. And that's all that is needed to be said or to be dismissed. Healthcare practitioners must oppose any sport or physical activity that is not appropriate the stage of growth, development, general condition of health, and level of training for children. They must act in the best interest of the health of children and adolescents without regard to any interests or pressures from the entourage. The health of your patient remains your priority, and the principle of independence in medical practice remains. Medical support at competitions. Usually the games or the events should have guidelines on the different sports disciplines that are included in the games or the order or whatever event, sporting event is taking place, so that the practitioner is aware and can adequately prepare themselves to serve or to care about these athletes in the various sports disciplines. Example, if you're covering, let's say, gymnastics, you should have a guideline. You should know where you'll be able to work, where you'll be able to stand, how far you'll be able to go to access the athlete, etc. If it's boxing, you should have guidelines about the sporting discipline, about competition, about how you can perform your medical duties should your athlete get injured. There should also be medical plans in place for every event, whether local or international. It is the responsibility of the medical team to prepare their emergency plans or work out their emergency plans as to how to execute should there be any emergencies. This is why the level of competencies of our healthcare practitioners at training and competition venue is very important. It is recommended that all members of a sports medicine team or a traveling team should possess competencies in BLS or ACLS. In our recent Olympics in Paris, there was an incident at basketball where a coach actually had a cardiac arrest, and it was physiotherapists and medical doctors on site who were able to save him. So I cannot underscore the importance of this in terms of team travel and or practitioners or medical team need to be well prepared, and there should be a communication system in place. Whether nowadays we have cell phones, before persons would use radios, but there should indeed be an adequate communication system so that you can communicate with persons training site, village, competition area, to be able to jump into action or spring into action should there be a need. You should be able to communicate your whereabouts during the sport event, right? So there should be coordination as well. Chapter 3, the code speaks about medical activities and guidelines The code is applicable to the IOC, Olympic Games, Youth Games, International Federation organized championships, and any event that is endorsed by the IOC. It may be adopted by any member of the Olympic movement. So LOCs are able to sign or consent or agree to the OMMC. There is a list of signatories which is publicly available from the IOC and on the IOC website. So it's good to know, or it would be good to know, if we or your country are signatories to the OMMC. Compliance. Physicians and healthcare practitioners should respect their own ethical and professional rules. So if you're licensed, your scope of practice, your professional rules, internationally, there are many professions that have international organizations. Example, for physiotherapy, we abide by World Physiotherapy rules. And I would imagine so for dentistry or chiropractic or medicine and medical practice. So we abide by these ethical and professional rules, plus those that are in the OMMC. The most favorable rule prevails when it comes on to doing no harm to the athlete. So always, the athlete is the priority of the OMMC. As alluded before, the scope of practice that applies in your individual countries applies when traveling with teams. LOC and local organizing committees, usually for international games, they apply for licensure for us to practice in other countries, or this is looked after by the IOC, right? And this is why it is important, and you'll hear more in terms of team members and accreditations and how serious it is to be falsely accredited as a age healthcare practitioner, because these larger bodies are responsible for applying for licensure for us to practice in other countries outside of where we are licensed or practice. It would be nice, or let me put it that way, or it is always recommended that medical indemnity, either the practitioner personally has, protect themselves or their practice, or the LOC, International Federation, or the event organizers themselves should look for some sort of insurance or indemnity insurance to protect us as healthcare practitioners. This again will protect us. So when we cover, say, a tramps, or when we go world championships, you can be in a civil suit, but usually in terms of if persons were to sue, if there is medical indemnity, then it's the larger bodies that are legally responsible then for our practice. The current OMMC has been in force since the 2016 Rio Olympics and is recognized at all the Olympics up to 2024. In terms of amending or amendments for the OMMC, usually a proposal can be made by athletes can be made by members of the entourage, can be made by members of an international federation or a LOC. These recommendations are submitted to the IOC Medical Commission, who reviews it and proposes it to the IOC Executive Board. It is reviewed there, and if accepted, it's approved and usually comes into play within 3 months of acceptance of these proposals. My bibliography is up, other than to say that all healthcare practitioners should be familiar with the World Anti-Doping Code. We should be familiar with our WADA prohibited list that's published every year. We should have a grasp on therapeutic use exemption and be able to identify who is the officer in your country. And this is very important in treating your athletes. So in summary, I would propose that breaking the rule of professional secrecy is a criminal offense in most countries, and we must be mindful of that. We should never provide information on the athlete's health status or medical treatment of an athlete to a third party without explicit informed consent. It is not necessary to provide the details to coach, club, IFs when you're advising them on how an athlete or about an athlete's injury, recovery process, treatment process. Basically have to inform them or advise them whether the athlete can safely participate in training and competition. On the matter of safely participating, we would have advised or informed the athletes. We must know that the athletes have rights, and once you have cleared yourself by advising them, informing them the pros and cons, etc., then if they decide to train and compete, you are there as a support system and as backup. Later on, we will learn more about the athlete's medical data and protection and storage, because all these factors are important to confidentiality and privacy, which the OMMC proposes or is strict on. I thank you for listening, and I hope you were informed, and you can, I'll put it back up as well. You can have a look yourself on the original documents and familiarize yourself with what we discuss. Thank you so much for listening. And if there are any questions, I'll take them.
Hi, Kieran. So I have a question, please. Right, you can. I have a question. Go ahead. Yeah, okay.
You can go
Look,
ahead.
so okay, no worries. So afternoon. So I'm just listening to you. I wanted to find, I don't know, this question in my head. Normally, when you go to a company Jamaica's team to France, let's just say, and when you talk about you needing to sort of like have was it indemnity and so on to be able to treat persons when you get over. But I've always thought that it was just like you are going with your team, so you are responsible for your people. So I'm just curious as to why sort of that international, if you like, indemnity. Why would that be necessary? Even though I am, at least I'm thinking that all I'm dealing with is kind of like my people, the people who I'm accustomed dealing with, etc. If you can just help me with that, please.
Okay. So when you travel with a team, it is very, very stressful. It can be very challenging. Oftentimes you hear, I'm not sure if my video is on. Oftentimes you hear of members of a medical team being identified or taking the fall, whether truthfully or untruthfully, for certain incidents in sports. So these incidents can tarnish your reputation, your financial situation, because you're innocent until proven guilty. So this is just one example where medical indemnity, some insurance or some security there would come into play. An athlete or any member of the entourage can say you did something which you want to challenge if you didn't. And again, you're innocent until proven guilty. So medical indemnity, take note on the part of, say, the International Federation or your LOC, is somewhat of a safeguard or protection for you. So if the athletes or the entourage can file a civil suit where you're sued directly. But if you're acting on behalf of the LOC or the Athletic Association or whatever federation, then usually with medical indemnity, your practice is not being sued. It's the federation or the LOC that will be sued. Does that make it shed any light for you, Sheldon?
Yes, yes, that helps
You can
because
also have your personal indemnity, because I figure that if you have a practice and you take out indemnity insurance, you probably spend more than what an IF or a LOC might invest in that.
okay. Thank you very much.
Does that answer your question?
Yes, it does. Yes, it does. It makes it clearer. And I actually had not thought about, it being that significant an issue. And I think the last point that you just made there, e- having your own indemnity might be even more critical because you don't know if something was to happen, just how much the level of indemnity that you might get from, this governing body. It might be enough, and it might still be up there on a lurch, you know. So
That is true. And um, it comes to mind, and other persons can chip in if they like. So say you, like here we have champs or we have other international events.
And we do have a sports medicine association that we are able to volunteer as a member of the association. In terms of indemnity, if you volunteered on your own, it then brings you, your practice, or whatever business that you have into direct line of being sued or held accountable. Whereas under the auspices of, say, a JASM, then the JASM would cover you somewhat. But it's always good to have personal indemnity.
All right, thank you. Do we have any more questions for Mrs. Brown? Going once, going twice. If there be none, we want to once again thank Mrs. Brown for her presentation. And we will move on to the next presenter. He is one that is not known to us, but we will get to know him. And he is the founder of AB3 Medical and Athlete Passport app, changing medical note keeping in private practice. He works as a sports general practitioner and a musculoskeletal doctor, currently working as head of medical and lead doctor roles with Hull City, GB Taekwondo, Leeds Rhinos, and Jamaica Rugby Football League. The AB3 medical journey began after being involved in a groundbreaking legal case in 2018, where crucial medical information was not disclosed between football teams. Fragmented data across different silos had near fatal consequences for this patient, as what you don't know, you can't help. After conducting extensive research amongst my peers in elite sport, my vision was to make a more accessible, standardized, and interoperable record for private healthcare. AB3 Medical's Passport app revolutionizes current practice by empowering the athletes with 24/7 access throughout their career. Any clinician can be shown all the right medical information immediately, whatever the club, country, or healthcare sector. Our patient-centered approach helps manage injuries and illness better and has huge financial and time implications for all stakeholders. Let us welcome Dr. Arindam Ronnie Banerjee with his presentation.
Hi there. Thank you very much for the introduction. I'll just share my screen. Sorry, is it sharing or
No, we're not seeing it.
not seeing it? Sorry, just bear with me. Okay, is that sharing now?
Yes.
Okay. Okay, so thank you for the introduction there. So yeah, a bit of background for myself. So as described, I'm a sports doctor, but work as a family doctor in NHS, so in the free service in the UK, and then work across various sports, which opens up all sorts of different electronic medical record systems, which we use there. And I work in a private musculoskeletal clinic where we use initially used handwriting as our notes, and we've moved that to our kind of electronic medical record system. So by kind of keeping notes, whether it's handwritten or across multiple different electronic medical records, it compromises care or can compromise care due to this fragmented data. And then when you couple that with poor handover across teams or countries or different healthcare sectors using different systems, it can lead to lots of different problems, whether it's athletes from health and performance or with the general population as well. As you said in my kind of bio, in 2018, it all started for me when I was working at Hull City, the football team, and information about this player wasn't disclosed from the previous team. He ended up, when I joined the medical team there, he ended up having a DVT, a blood clot in the leg. And that led us to start doing lots and lots of different investigations, and we found that he had lots of chronic blood clots, which has sat in his lungs, unfortunately. And after having lots of different camera tests and other investigations, we found out that he had an inflammatory bowel condition, ulcerative colitis. Unfortunate for him, he then developed bowel cancer, and he managed to get back after surgery to playing at the end of his contract with us. But this then led to a big lawsuit. And after listening to Per Ann's conversation about kind of medical legal issues, it led to a big change in practice, and it led to a £1 million lawsuit case where our club sued the previous club for not disclosing medical information. That was the final kind of thing for me where I wanted to implement some sort of change, and it led me to do research across my peers as described. So it was quite extensive research where we did it over 77 football doctors and 28 rugby league doctors. And it basically showed in the UK that 49% of us in football, out of those 77 doctors, and 90% of the 28 doctors in rugby league were not passing on medical information when someone left their care with the athlete's consent. When you add to that, there are 10 plus different systems in use. It leads to all sorts of problems. And that then led to me creating the patient passport app as described, where the dream scenario is an athlete joins this or a patient joins this at the beginning of their career, and then this follows them around as a passport on their phone, which they can show any clinician anywhere. So we've presented our work at various conferences across Europe, and have been kind of represented at various kind of sports tech awards on the innovation kind of category. But I wanted to just give some real life cases of why it's important that the patient should have access to their notes, and why as doctors we need to make fully informed decisions, because we cannot help what we don't know. And no matter if we're the best clinician, if we don't have all the information, then we can't treat that patient to the best of our ability. So I just share this first video. This is one of the players. This is 3 players from the rugby league team Jamaica from our World Cup.
Bishop, current club Sheffield Eagles, previous clubs Leeds Rhinos, Salford Red Devils, Wakefield Trinity, and York City Knights. Throughout my career, about 16 years now, I've had various injuries, 4 shoulder operations, a fractured skull, ACL, and also medical issues. I've had 2 PEs as well. So to keep all that information together and remember dates is quite difficult when moving from club to club. So to have something at hand where it can travel with you and you can just hand it over to your current doctor would be ideal. Along with that, every year we have blood tests, heart scans, and concussion tests. And I also have a separate GP for ongoing stuff to do with my PEs as well. So as I said, to get all that information in one place would be a massive advantage due to it being hard to go back 10, 15 plus years to find things to bring to your current club.
So I don't know if you managed to catch all of that, but this player has been around for 16 plus years professionally. He's had a fractured skull, 4 previous shoulder operations. He's had 2 blood clots on his lungs. So lots of complex history with him. And then on top of that, he has his yearly compulsory scans or screening. And all of these different notes from different clubs. And as I've just told previously, if 90% of us aren't passing on information between those clubs, then we can't make proper decisions on people like Ben Jones's case. So I'll just play a couple more of these because I feel these are quite informative things to listen to as real life cases.
Having an idea like this where everything and all the information is in one place is ideal and perfect for any persons like me. Just to give you an example, during a national camp now with Jamaica, I really injured my knee. I had lots of treatment while I've been here, scans, injections, all the other doctor treatment that I've had while I'm here. Now, for instance, when I go back to my club, they're knowing what state I've come back in, what injuries I've got, what precautions they may need to take with training, and how I would maybe need to be adapted in training around the injuries that I've had. It would save a lot of time. It would save people not having to treat me and necessarily scan me again because they can't find results. They have all that information to hand, and it'd be very helpful for not only me but them as well.
And that was during Jamaica camp. So he had a quite significant MCL injury during camp, and we were using the system then because he was in between clubs, Jamal, and as a result, he didn't have the ability to keep on funding new scans and investigations and seeing different specialists. So the tests he had done with us, the notes which we kept, the injections and other things performed by putting it all on one system. We were able to put it into his hands, and then he was able to show that to whichever doctor or whichever club he moved on to in the future. And then this final video is the captain, as Michael Lawrence. So he's edged towards retirement now, and it was just a quick video from him just to talk about how it starts at the beginning of the career, moving forwards into retirement.
Moving forward, if I retire or if I move to another club or if I'm ever on holiday and I go abroad and I have any issues and my knee flares up,
hear you, but
I need to have all that access to all that information right there in my fingertips on my
Kind
phone.
of, me know explain it, a little change with the change.
Phone call, trying to get paperwork. So I have to have everything there at the touch of a button. Makes life much easier.
Okay. So that's then led me, as we said, to look into how we can make it a much more patient-centric approach. And I want to talk how I hope this can benefit yourselves as a sporting association to improve note keeping, but more importantly, then improve health and performance of your athletes, and then medico-legally protect yourselves as well. So I wanted to create something with an A to E approach, we called it. So we wanted standardization. We wanted to make sure that instead of the 10 plus different systems which were being used, that by minimizing the amount of systems and by the athlete always, or the patient always having access to their record, meant that there was a standardized way that information could be passed on wherever they were in the country, whatever healthcare sector they were at, or if they are abroad. We wanted to make it interoperable. So interoperable meaning that it was able to be shown across different healthcare sectors. So if an athlete is seeing yourselves in a private clinic, or seeing you on the sports field or arena, and then they go for state care, and then they cannot see all of the notes or what you've written down. With our system, you've got a way where the athlete can show everything on their record, but also that clinician, as I'll show you later, that doctor or medic, they will be able to write notes directly into their app, or they will be able to do an audio consultation directly into their app. So the next of our A to E approach was to make it accessible and portable. So all of these different rules I made was following the Data Protection Act, which we have in the UK, which are standardized points, which we have, which you should follow from data to make sure that it is all being kept appropriately, as Pierre-Anne kind of alluded to. So I then wanted to make a template which could be used for medicals. So when an athlete joins your club, or when an athlete joins somewhere new, they are able to show everything which has previously happened to them, as we will go into later, as well as showing what they've previously had. It allows that medical staff moving forwards to input data from their dashboard directly into their app, so that when they go on international duty or abroad, or move on to the next club or retire, they will always have access to that. And that leads to that final point of making the transition from athlete into retirement more safe, because in the UK, when someone leaves 5 years, 10 years, 20 years of private care within different club settings or country settings, when they move back into the normal way of life, into retirement, they then go back into NHS care, where they have no idea what medical care they have had over the last 10, 20 years, which is frightening. Or if they go into an emergency hospital, they will not have any clue of any blood test, heart scan, concussion testing, MRI scans, anything else they have had done. So from how we want to help and collaborate with yourselves, so a few notes written on the slide here is we want to enhance the safety and health management of your athletes. We want to do that by as simple way as possible, always making it accessible to the athlete and to the medic. We want to stop any catastrophic event which definitely could have been stopped, or we want to minimize that risk, and do that by having minimal time. So as in not repeating unnecessary scans or history taking, because the information has already been got from your predecessors. We want to have minimal cost. So we don't want to repeat unnecessary or duplicate unnecessary investigations. And we want to reduce manpower. So we want to reduce the amount of clinician and time that you're spending, all of your resources. So we currently are used across various sports in UK, so football, rugby. So I've come back from Paris with GB Taekwondo, where we use that. Ice hockey across their kind of leagues. We use in private clinics and the NHS, as said. And then this is just a few of kind of note statements which various people have made. So ex-players, current players, doctors, just about what their thoughts are about the system. So moving on, I'll just give you a taste of what the actual system is. So an athlete or patient, they register by downloading the app from the App Store. So we've currently changed the way which the system is. So it's fully live and you guys will be able to download it from the App Store on iPhone. On your Google Play on Android, you will not be able to download it just yet. However, there is a different way, which I'll be able to show later, how you can set up an account on that. So I'll just from this first picture here, this one here is just about a medical screen, which every single person who registers onto the system, they then it gets icon telling them to fill out a medical screen and questions, which provides again the medic much more information about that patient without them having to ask them any questions at all. So they could do that in your waiting rooms, they could do that before they join your club, and then you've already got a vast majority of history taking done there. So I'm just going to play some video again of that for you. So this is just the registration process. So from here, you register either as an athlete, you register as the medic, you can register as putting your whole team onto the system. And then if you're an external organization, which means if you are a radiology department, if you are a cardiologist, or you are any different specialist, if you want to start a relationship with that team and then you want to directly input information, you request that by just clicking on here. So I'll just follow it through, and this is an athlete, how they register. So just from that, very quickly moving between the screenshots, it's just getting all the demographics of that patient again without you having to complete any forms or anything. So your name, date of birth, next of kin, emergency contact details, address. So all of that information is there, and you'll have that on your dashboard, but obviously the patient will have that on their phones as well. And then this one's a quick video, but I just wanted to show you because there's 30, 40 questions on here, which are very, can be done within a few minutes, but it's very useful information to have. So it's gone very, very quickly through it, but it gives a really comprehensive multi-system overview of what's going on with that patient before you've met them and you've not had to do any work asking all of those questions through them. And clearly, if there is anything abnormal or positive findings from that, you can delve further into that history. So moving back to here, this is currently the screen which the athlete sees or the patient sees when they open up the app. It's a really simple user interface of what they see and how it works. So on one side of the body, you have the injuries. So that's split into head, arm, trunk, leg. And on the other side of the body, it will split into medical illness or screening. So screening will be things like the annual or biannual cardiac screening or blood tests or concussion testings. So just to give a bit more idea of that. So we follow kind of, as Pierre mentioned in the first one, we've got explicit consent and medical security standards are followed. Anything which is on this app is being put on there from the medical dashboard. So it improves the clinician's note keeping because anything which you write on there, apart from rehab notes, is put directly onto the app. So it improves the standard of note keeping from that. It gives the patient direct access to that. And then from a consent point of view, the patient, it's up to them whether or not they decide to show someone else, whether that be another doctor in a different country or a different club or their coach, or if they want to show anybody, if they don't want to show anybody their phone, they don't have to. So this gives them 24/7 access across anywhere in the world. We've mentioned how it's kind of the read-only categories. It's only read-only categories of injury, illness, and screening. They can't change anything on the phone or what's written. They can add files to the app, but they cannot change anything which is written on there. At the top, there is a scrolling toolbar where you can separate things into problems, consultations, medications, results, letters, and treatments. So you can add things like PDF documents, you can add images onto there. A third-party clinician, so someone who's not the usual team medic, they can add a consultation. So this final picture here, it shows you can either add a written consultation or an audio consultation. So from a medical point of view, we know that doctors and physios and medics were busy, and if you're in an emergency department or you're abroad or pitch side, you might not have time to write things. So if you have access to the person's phone and you're not their usual team clinician, you can write directly very quickly into there and submit it. That gets shown onto the team dashboard, so the usual medics can see that instantly. If you don't have time to write anything or you prefer to do an audio, then you just submit that audio dictation, and again that goes directly onto the dashboard. As a separate thing on the app, we wanted it to be like a health and wellness resource section as well. So we wanted to provide reputable medical information tools, so things like nutrition, recovery, mental health, and well-being. And if there are certain things a team or association want to put on there themselves, then it's up to you, whatever you want to put on there, whether it's recovery things or anti-doping or your own national kind of events and things you can put on there. These icons at the bottom, so this one over here, the alarm, that basically allows notifications. So through the dashboard, you can send a notification to the athlete on that. And then it pops up on their app. So for example, you have a radiology appointment at 4 p.m. today. So that's the information about AB3's dashboard, but I just wanted to say, as well as that, we recognize that this obviously requires a patient to have access to their app. So if they don't have access to their app for scenarios such as a collapse or in a semi-conscious state, if they don't have access to their phone, then we've partnered with a company called MyCode, so Medical Information Code, which makes sure that you still have access to all of that emergency medical information. So for the athlete, you wear this, whether it's as a key ring or a sticker or a permanent sticker, a card, and it's got a QR code on this. And on this QR code, the medic can scan this, or the emergency responder can scan this, and then instantly all of that vital emergency contact information or healthcare information is accessible. So whether it's things like to contact their next of kin, whether it's past medical history like asthma, epilepsy, or heart problems, it's all on there to see. So this is how it works. So this is actually a live one, so I'll keep it on the screen long enough if anyone wants to, but if you zoomed in to one of the QR codes on the first picture, then you would see, once you tick on that, it would come up and it would actually show live information about that person, which is pretty amazing for that emergency scenario, as you've said, in the Olympics where someone had an emergency event. But that could be at any sporting event anywhere in the world. So I'll just leave this on the screen.
Mhm.
Ready?
Okay. Moving on then. So just as a summary, really, so from why it's been created. So following this kind of snake infographic, if there's poor note keeping, and then if there's multiple systems in use, so you have poor interoperability. If you then couple that with the poor handover, which our research has shown, that leads to medics having a lack of knowledge about that patient, which then results in us making poor decisions about that patient's care. That then leaves us open for litigation, medico-legally, that leaves us wide open, as previously mentioned. It also leads to increased time of trying to find the right diagnosis or treatment, and increased cost, which all of these together leads to increased danger to that player's health. So from all of this, I'll just quickly show the dashboard, the medical dashboard. So you've just got a taste of how that works. And then we'll open it up to some questions. So on the dashboard, this is what it looks like. This is on our old dashboard, which we're just changing currently. But all of your list of patients will be down here. If you click onto a patient, you will see all of the problems which that patient has. All the major problems will come to the top with an asterisk. All the problems will have a from and an until date. If you want to find out more information about that problem, you just open up for a summary. by pressing the information button, you'll see everything which is previously done for that problem. And then this all comes from here. So you've seen how this links on the app, so you can add consultations, link it to that problem, put your details in, the date, your registration information, history, exam, investigations, treatments. You can then submit it here. Similar for each one of these, but we'll open up a few of them. So if I wanted to add a letter onto here, again, you link the problem, and then you just choose your file here, and then you can submit on there. So that's straightforward. You can put things like your medications, so any medications you've prescribed, again, that will go on there and that'll go directly onto the app. And similarly, you can do that for, injections. And again, just submitting through. You can make external referrals. So for that external organization, we said, so if I wanted a cardiologist to do screening for all my athletes, I could share all of the cardiac information for each one of my team, and then they would not see any other notes because they do not have consent for that. And then they would make more informed decisions about cardiac, what's been going on. They could see all their previous screens, no matter who or where it was done, and then they can directly input information onto here. If there's things which you didn't want the athlete to see, or if you were rehabbing someone from a long-term injury, then it's not necessary to put months of notes on there. You might want to just make rehab notes. So we call them SOAP notes. So subjective, objective, assessment, and plan. And then if you submit this, then that does not go onto the app, but it still gives medico-legally protection that you've written some notes. I mentioned about tools. So this is where you can add information about whatever it might be, nutrition recovery, or anti-doping or anything else on there. And that is the end of my presentation.
All right, thank you, Dr. Banerjee. There is one question from Ingrid Burrows. Can notes be added from the physician's own EHR?
So it can be, if it's integrated into the system, it can be. So if it's integrated into the system, yes. If it's not integrated into the system, then it becomes more difficult.
Okay. Are there any other questions for Dr. Banerjee?
But you had an option, Doc, to choose files.
Yes.
If you're on your computer, wouldn't you be able to grab a file from your device to add into the app tree?
Yeah, so the add file is for us, but it's also for the patient. So from a medic point of view, so if I'm the team clinician, I can add whatever file I want. So as a result, as a letter, as a treatment, I can add files onto the dashboard that way. And then the player, the patient, would be able to see that on their app. Similarly, if there was they wanted to show a condition, if they wanted to show me a skin rash or a laceration or something they wanted advice on, or if they wanted to add an old letter which I had not seen before, they have the ability on the app to add a file, and then that then becomes visible for me on the dashboard.
Is that what Dr. Burrows was asking? Dr. Burrows?
Hi, sorry, I was just trying to be clear. So you have to have the app to add notes?
So the app is for the patient, so the patient passport, that's what the app is for. So for us as the clinician, we have the dashboard. So the dashboard you do on your desktop, laptop, or on your phone. So you can you have a separate dashboard where you can write notes on, and those notes automatically sync to the patient's app. So the medic, we do not have the app. The patient has the app, but we have a dashboard. So they're linked. So as soon as we write things on our dashboard, and say if we're writing a consultation or we're writing anything, then it means that you've written it and it's documented on your own system, but then also it gets transferred over to that patient on their app.
Okay, so for doctors and physicians and any medical practitioner without the dashboard, how would they add things to the app? Some of our athletes live overseas and they study overseas and they see physicians overseas. These physicians may not have this app. How would the information be added to the patient's record?
So from the app, so once they download the app, so if you have the iPhone, like I said, you'd be able to go onto the App Store and download it now. We're hoping for Google Play, it'll be available for you guys hopefully in the next couple of weeks. That's what my developer has said. So on Android. So what happens is that the athlete downloads the app, and then they go through the medical screen process. They do everything else on. Even if they didn't have a usual team clinician, they can still use it. And then if they're seeing medics abroad, then there's that plus button at the bottom on the app, where if you press that, then you're able, as a third-party clinician, so that medic abroad, they're able to add a consultation directly onto that. So whether it's a typed or a audio consultation, and it goes. So if you're sat there as back at home as the usual team medic, but you currently don't have access to the dashboard, then we need to give you access to the dashboard so that you are the usual team clinician. If that overseas clinician is the regular doctor at the minute, then they can be added on as the regular team doctor. However, it allows that third party person, wherever they are in the world, to instantly write notes as well. Does that answer your question?
Yes, I think so. Thank you. So you'd have to write notes twice though, because I'd have to write in my own electronic health records and then I have to write in this app as well.
So if you're saying about your athletes abroad, then you don't have to write. If you don't want to, you don't have to write anything. So you can.
But the physicians overseas, I'm asking them to write twice, because I'm sure they have to keep their own records and then they would have to write into this app as well.
The clinicians abroad, well, it depends. It depends how good their medical note keeping full stop is, because if they're using their own system, then great, they can use their own system. If I'm asking to, from an athlete perspective, you will see then, when from experience, when you've asked that athlete for information from what that medic has said wherever they are in the world, they have to then trawl around and try and find consultation letters or results or whatever it is, and then they'll give you the paper copies, or they'll send you a picture of those things. This is a completely different way of doing that, so that everything is obviously in their fingertips whenever they need it. And you sat back at home, you instantly have access to that. So if that third party medic is already writing notes on a system, then yes, And if they don't want to write things on this and use it as their first system, then yes, they would be duplicating it. If, however, they currently aren't writing anything, it's a very quick way of them doing an audio dictation or them putting they don't even have to write anything. If they've got a letter, then your athlete might just add the file of that letter. And if you're sat at home, then you'll be able to see that letter instantly in a secure portal rather than having to do it. But can you give the example of like when you say the abroad, when you say the other medics abroad, can you give the example from an athlete perspective how that works?
Well, some of our athletes go to university overseas, and so they see physicians and physiotherapists and anything they need to see, they would see overseas. And then when they return to Barbados or they're part of our national teams, we don't necessarily know what happened to them while they were at college.
Yeah, that's
which is a problem, yes, because they come back and we don't know how their injuries have been rehabbed or what was done. And sometimes it can be difficult to have access to that information.
Yeah, absolutely. And that's an inherent problem everywhere, isn't it? So even if they weren't doing writing anything, they could at least do the audio thing, or they could add the files themselves there and then, so you instantly see it. Yeah.
And what is the cost of this system?
It varies. So it varies from I'm sat there, I work across different sports, whether it's football or Olympic sports or rugby, where it's financially it's very different. So I'm fully aware, kind of from a Caribbean perspective and working with Jamaica Rugby League, the money was very different from what was available medically. So I'm very open to kind of discussing that per user, per team.
There's another question from Carol Debeek. How would one register as a clinician? Do we start from the patient's or the athlete's link?
So let me see if am I still sharing? Let me share my screen. Okay, fine. So on this screen, so this is beta.ab3medical.com. If you went on that on your desktop, currently it's our developers are working with it at the minute. But if you clicked on here, then it would open up the same screen as that athlete, medic, team admin, and external organizations. You just click on to medic, and then it will open up a list of questions of just signing up as a medic. As soon as you've signed up as the medic, then it will come to the admin staff of AB3, and then they will approve you as a medic for Team Jamaica or whichever team you are, and then we accept you as a medic for that team, and then you can see every single athlete which is joined under that care.
Okay, thank you. And one more question. Once the athlete downloads the app and pays registration fee, is there a maintenance fee monthly or yearly?
Yeah, it's yearly, but it's not, we don't charge the generally speaking, we don't charge the athlete. So per month or per year, it's usually the team or it's usually the organization. So if you have X amount of users under your practice care, that's how the cost gets determined. From where a patient might pay a fee is when they are a solo athlete, they're not affiliated to an organization, or if they are a patient. So we want to use this not just across sports. When we're looking at other countries' infrastructure and depending on what they have for their usual patients, this can be used for just for health promotion, because if you're doing annual screens we've got other cardiac screening questionnaires, other things on there. So instead of using manpower of the medical staff doing it, these guys are actually doing the screenings themselves. So all of that stuff is free. So someone can download the app for free. You can do the screens for free, and then the medical staff can see those screens for free. But as soon as you're using it and writing notes on there as a note-keeping facility, that's where the cost comes in. The athlete or patient will have to pay when there's a separate the tool section I showed earlier, so the resource section. So whether there's things like the nutrition, recovery, mental health, you will have free resources on there, but also they'll have discounted resources on there. So it depends on what you yourselves want to do. But from over here, we will have people on there. They will then get discounts of 5%, 10%, 20% off said X reputable product, which then they can get what we would class elite or reputable resources from. So that's where there might be a cost for the athlete. Otherwise, the cost comes from the organization or the association.
All right, thank you. There's one more question that just came in.
Yeah.
How many athletes and coaches do you currently have subscribed or registered on this app, and what regions are they in?
So we have football. So we have football. We have various clubs which are on it. It's all, vast majority of these are all UK based. So we have football teams. We have ice hockey across all of the professional league. We have motorsport. We've got a couple of teams on that. We have 10+ rugby league teams on it. We have some private musculoskeletal clinics on it. And so from numbers of teams, there's quite a few teams on there, and it varies how many athletes there might be. There might be 30 within one squad, and that's it. Whereas in other teams, they'll have a men's team, a women's team, their academy teams on there. So there will be 100+ on there. And what's interesting is because we've now introduced that screening, it's other bits which I've not mentioned is that also on there we've got the inbuilt concussion testing. So I'm not sure if yourselves use the standardized SCAT forms for concussion screening. So that's what we use, and we have an inbuilt form for that. So now it's become a lot more appealing to medical staff to have this, because it's got an inbuilt SCAT on it, and it's got the inbuilt screening things on there. So by having the inbuilt screening, they're recognizing it's obviously reducing their workload as well, and they're finding out more about their patients. So it's become a real good tool during pre-season for questionnaires and things before they've even come in through the door.
Okay, this is the final question I see here. Data protection varies from country to country. Are you considering that in the app's use specific to the federation or organization?
Yes. So so I'm sat here as the sports medicine kind of clinician, and also I've got personal experience across the legal case we mentioned, but and the research and the things. However, we've got a separate team where we've got our data lawyers, where we have our developers and who are well versed with data protection across globally. So fully aware that data protection varies across different countries. So yes, it's definitely considered.
Okay, thank you so much, Dr. Banerjee. This presentation was very informative, and I know that it is very applicable to us here. So it's just a matter of time before, we start utilizing this app or something along that line. I would like you to just leave your contact information in the chat for everyone.
No
so that
problem.
they can contact you if they need to. All right. Thanks,
Okay.
everyone.
Thank you.
We're gonna have our next presenter. Mrs. Brown. Oh,
Hi, everyone. So our next presenter is, are you getting our feedback?
you have another device up, Miss B? It's echoing.
Our next presenter is Miss Carrie. Carrie is a dedicated and experienced physical therapist with over 15 years of experience evaluating and effectively managing the treatment of patients with various conditions. She's a member of the Jamaica Association of Sports Medicine and our Central chapter. Adept in working as an autonomous practitioner while fully integrated in the multidisciplinary setting, she has extensive administrative experience as head of departments both locally and overseas. Consultant physiotherapist in the development and implementation of physiotherapy service in new areas of the service. She spearheads job evaluation exercise for the physiotherapy services in Jamaica, and she has been a past president of the Jamaica Association of Physical Therapists. She's currently a physiotherapist at the Jamaica Constabulary Force, the Jamaica Police Convalescent Center. She has worked with the Ministry of Health, serving at Spanish Town Hospital. She has been consultant physiotherapist at the Ministry of Local Government Board of Supervision and is involved in training healthcare workers in areas of ergonomics, mobility transfers, and safety. She has been charge physiotherapist with the Ministry of Health in the Turks and Caicos Islands and worked on Grand Turks. She's presently pursuing a DPT with a focus on musculoskeletal pain management through EIM Curriculum University. She has a diploma in physical therapy from the University of the West Indies. She's an affiliate member of the American Physical Therapy Association, and she's licensed in Jamaica with the Council of Professional Supplementary Medicine. As I said before, a member of JPA and JASM. She has traveled as a physiotherapist with our junior athletes to the 2002 World Junior Championships in athletics. She has traveled for Carifta Games from 2007, 2011, 2017. She has also represented at the Commonwealth Games and Pan Am Games as well. And she has also been a physiotherapist working with Special Olympics and have been to the Special Olympics. Please help me welcome Miss Carrie Lewis as she presents on what's in the book.
Good afternoon, everyone. Thank you so very much, Baron. I am hoping that my audio is clear. I am competing against two generators. So could you indicate if you could hear me, please?
Loud and clear.
Beautiful. Are you able to see my screen?
Yes, we can.
All right, so I would like to thank Central Chapter of the Jamaica Association of Sports Medicine for inviting me to be a part of the Keeping Pace series. So today we delve into what's in the medical bag and just a few objectives. We just need to highlight the essentials of the medical and the physiotherapy bag, understand some of the factors taken into consideration when packing these bags, and the importance of considering the local healthcare systems, meaning your destination countries, your regional risks, and other challenges when traveling. So why do we need to know what is in our medical kits anyway, and why is it important? As sports medicine professionals, we work closely with athletes to optimize their performance. And during team travel, it is of utmost importance for us to have all the essentials to enable the team to be at its best. Jamaica, as well as the Caribbean, has seen significant increase in sport participation across a range of sporting events over the last 3 decades. And from a medical standpoint, increased participation could be viewed as potential injuries, and therefore our sports medicine practitioners covering the events should always be prepared for any form of emergency. As you know, each sport has similar but unique medical problems. Therefore, it is important for adequate and careful advanced planning to anticipate these casualties at sporting events. It requires preparation. And part of this preparation includes the provision of medical and physiotherapy kits or bags that are properly composed. And while these bags are being composed, consideration should not only be limited to the nature of the sporting event, but also to the area where the team will be traveling to. Your sports medicine experience, that is vital. Your aviation experience, the environmental, and your travel medicine experience. So when assembling your bag, the nature of the sport event, how does this influence what constitutes your bag? Different sport will have different kind of injuries. The things you would probably take for a sport like rugby will be different from that for a swim team, or that for a marathon or a cycle tour or something like that. It will also mean that what you will take for your athletes with disabilities will be different from your able-bodied athletes, and that will affect your decision for your equipment and your supplies. You also need to take in consideration the age group of your athlete, the gender, the health status, and the chronic medication profile.
And this not only affects your athletes, but you need to take in consideration the other team members as well. As there are times when you actually spend more time treating your officials than you actually do the athletes. And for the sports medicine practitioners among us, you can agree that this happens more than once. It is also good if you know the previous injury profile of the athlete, and this is just tying into what Ronnie spoke about just now. If you have an idea of the athletes you're traveling with and their previous injury profile, then you're at an advantage as to what to expect and therefore what you need to have with you. Where you'll be going is extremely important. Medical support services vary across countries, and sometimes the country to which you're traveling is not as experienced in sports medicine. So the coverage, the local coverage is not as you would expect. There are supplies that are not available as readily as you would have thought. And a little research need to go into it before you actually travel, so you know what is available, what is not, what their support services will be. There's also the rules and regulation for the government of that country that you're going to. There may be regulations regarding border importation of medication and supplies that may limit what you may be able to carry in your bag. You may need to get declaration for some of your medications, some of your supplies. You may need to acquire a temporary medical license, as Perrin has alluded to before, or you may need to tender your own local medical registration to the host country in order to gain permission to travel. There are times when medication that you would be able to get over the counter here or in your country. It is a prescription item in that country that you're traveling. And all of these things you need to know beforehand. Vaccination requirements for your host country, you need to ensure that the team, athletes, and officials are adequately immunized to go into the country. There have been cases where on entering the country, persons are not allowed because of vaccinations not done. We could eliminate that issue by just doing a little research before. The supply source, important to know access in the event that your stock is depleted, how easy it is for it to be replenished, depending on length of stay. Once again, a little research is needed so you know how to pack your bag. You may need to pack excess of certain things. Certain medical challenges as well, and this could impact your athletes. Environmental challenges, the quality of the food, quality of the water, what kind of vector infestation is endemic to that country, be it mosquitoes or snakes or spiders or whatever it is, then the bag would have to be packed with stuff for. It is also important to determine the voltage, electrical voltage, and the nature of the plug points so that your kit can have adapters so that your equipment can actually work when you get there. And all of that is important, or else your treatment will be hampered whenever you land. In air travel, there are times when the medical kit cannot go aboard the aircraft. And if that is so, and it is a check on the luggage, then it is advisable for our medical practitioners to have a smaller handheld kit. And that would be one without blades or knives or needles or liquids. And that can be used for onboard management if such a scenario occurs. What should our medical bag look like? And this is very ideal. It is one that is convertible. It can go from a pull-on, and in the event of an emergency, it becomes a backpack. Easy to move. I'm not sure how many of us have seen one like this. I certainly haven't, but it is the ideal thing. So it should be large enough to carry a fair amount of equipment and stock. And it should also be adapted and carried as a backpack when traveling distances. That is ideal. It should be lockable, have a paramedic style removable transparent compartments, the contents of which can be packed according to broad categories. For example, your diagnostics, dressing, medications, splints, injectables, emergency drugs, etc. So that would facilitate easy and rapid access under emergency conditions. And of course, clearly labeled. For the contents of the medical bag, what should we expect to see? I have just divided them up into simple categories. Of course, my list is not limited, it includes. So for your diagnostics, we expect to have your sphix, your blood pressure cuff, your stethoscope, your diagnostic ENT equipment, your pocket AED, scissors, airways of different sizes, endotracheal tubes, amber bag, urine test strips, glucometer, tongue depressors. And of course, I'm giving general contents of the bag now.
Gary, are you still there? We're not hearing you. She's still on. Oh no, she got kicked off.
Yes, she probably got kicked off. Let me try and contact her.
Right.
One tick on my message, so she probably lost power. Let me try calling directly.
Okay, she's coming back on. Thought I saw her connected. But she's off again.
No, I'm here, Pierre.
We see.
Pierre, Pierre,
All right, we're not hearing you, Carrie. We see that you're on.
We're hearing you. We can continue. I don't know why Mrs. Brown not hearing you.
I please accept my apologies on behalf of Beryl.
You're still muted, Carrie.
Am I?
No, we're hearing you. We're hearing you.
Okay. So it's just Pierre that's not hearing me then. That's fair. Okay. Trying to do this. See my screen?
Yes, yes.
All right, I think this is where I was. So the contents of the medical bag.
Still not hearing you, Carrie.
Please.
You're the only one
We're
that's not
hearing
hearing
her.
her.
We're hearing her. You're not hearing her. Everybody else is.
All right, Pierre, you're alone. So as I was saying, the contents of the medical bag, this list is and so there are other things that would be necessary depending on your area of travel, the sport you're traveling with, if it is multidisciplinary or not. But we're just highlighting some of the essentials. So your blood pressure cuff, your stethoscope, your diagnostic ENT equipment, pocket AED, scissors, airways of different sizes, your endotrache tubes, amber bag, your urine test strips, glucometer, tongue depressors, your eye kit, reflex hammers, peak flow meter and mouthpieces, laryngoscope, and a pocket knife with multi-tool can be extremely important. All things for dressings, your suture kit. That includes your needle holder, forceps, blades, scissors, wound glue, closure strip, steri-strip, your plasters of varying sizes, bandages, swabs, iodine, razor blades, antiseptic creams, and solutions, your antibiotic creams, tapes, waterproof dressings. And of course, you need your author supplies, your shoulder slings, your braces for the different body parts, and your splints, and light splinting materials, and stuff like a walking boot. Your medications. These include your injections and emergency drugs. So I won't get into what those are. Analgesics, antibiotics, your antifungals, your antivirals, your anti-inflammatories, antihistamines, your cardiovascular agents, your dermatological preparations, ophthalmics, respiratory agents, your ENT agents, your urogenital and gynecological agents, and your gastrointestinal agents. And I happen to know those are very important. So, points to note when you're doing your kit, extremely important is to have access to the current water prohibited list. Depending on where you're going, you probably won't be able to access it online. So I think they still have a little booklet that you can get, right, Dr. Jones? Other point to note, dispensing of medication is done by the team physician. And that is extremely important to note. Members of the traveling team, be it athletes or official, need to declare their medical conditions and their medication regime. It is also important sometimes to know the amount of medication they're traveling with. Sometimes person traveling, not realizing that their medications will be finished overseas and you don't have access. As parents stated just now, up-to-date BLS certification, extremely important. All members of the health team at any point in time can be a part of an emergency, and we all need to be certified. It could be the difference between life and death, as was the case she stated at the last Olympics. So what's in the physio bag? This bag is not as complicated as a medical bag, but in a sense it is even more complicated because the first thing in the bag is lots of knowledge and wisdom. And that makes it a little bit more complicated. So our modalities usually include our electrotherapy devices, and these could be anything from electrical stimulators to TENS units, laser therapy or therapeutic ultrasounds, magnetic therapy, our disposables, our oils and creams for massage, as well or myofascial release techniques, as well as for pain relief. A variety of bandages, wraps, tapes, or first aid items, and splints. And back to knowledge and wisdom. Different physiotherapists will be trained in different kind of manual techniques and have different schools of thought. So, and there are other techniques which persons are trained in: blood flow restriction training, cupping, mobilizations, manipulations, myofascial release, and exercise prescriptions. Of course, this part of the bag is the complex part. So in summary, before I get bounced off again, it is important when preparing these bags for us to be comprehensively prepared, ensuring that the medical and the physiotherapy team is fully equipped to handle emergencies, injury prevention, and recovery needs during international travel. The key items include medications, emergency equipment, diagnostics, first aid essentials tailored to the athlete requirements, the sport requirement, and also the area of travel. Incorporating manual therapy tools, rehabilitation equipment, injury prevention supplies, and portable modalities to support the athletes when traveling is vital for the physiotherapist, especially when you look at the injury profile of the athletes you're traveling with. Which is why what Ronnie presented before is extremely important and something we should look into. Adapting the bag contents based on the specific demands and risk associated with each sport. So there's sport-specific customization if it is not a multi-sport event. When organizing, be efficient with packing and transporting supplies while you're navigating international regulations and also dealing with cultural differences. And the importance of being flexible and adaptable and be able to have real-time problem-solving abilities during international competition. So you're prepared for any scenario. What is also very important is for the medical bags to be in the right hands. So in traveling, we would like the persons who are traveling to be sports medicine professionals who are experienced, and that the bag you're carrying is actually aligned to your profession. These are my references. Thank you for your attention, and I'm still online.
Yay, you did it. And I'm happy that you were able to stay online. Thank you so much, Carrie, for that very informative presentation. And we're going to invite questions. I'll take 3. And then we, having had that wonderful presentation, we are set to jet. And we are going to be taking flight. Are there any questions? Go ahead, Auntie Pat, senior physio, seasoned sports medicine practitioner.
Hello, can you hear me?
Yes,
Yes,
Auntie Pat.
I can hear
Okay,
you.
good
Go ahead.
afternoon, everybody. A comment I'd like to make with respect to the equipment.
Yes, ma'am.
The organization you're traveling with, the JASM or GOA, they ought to know and be given a list of your electrical equipment that you're taking or therapeutic equipment, because they need to be insured. And if we are lending our equipment from JASM, as I speak, for the team, I think it's the organization's responsibility to ensure all these equipment, because we have spent a lot of money getting them. So well beforehand, and of course, I know all the implications. You don't know when you're traveling. Sometimes you get 2 weeks notice. We're lucky to get a month, but those things take time. So you have to list everything, the value, what you call it now, number, serial number, and all of that. Those have to be given to the organization, and they have to now procure insurance. And on the note of injuries, and so that is another reason why physios who know the athletes should be traveling with the athletes, or at least get to know the team well beforehand, so you know the athletes, and they have a lot of confidence in the physios. So they will share things when they wouldn't share things with others. So that's just my little. Oh, and another thing. The only organization I know of leaving Jamaica, the team, is Special Olympics. We never leave without a folder with all the medical information of each and every athlete, including officials. By the international standards, we have to take it with them, with us. So you know everything, and you go through all of that before. And of course, we're accustomed to working with the athletes months and months ahead. So we know each person. Just my little comment. Thank you.
That's true.
Thank you, Auntie Pat. When we are adequately or advised early and can plan and put together and know our team members before we travel, that is all well and good. When we have a list of athletes and can gather information, and when we subscribe to AB3, then we will have everything under our belts. One additional piece as well, Auntie Pat, is exemption for the equipment that we take out.
Right.
These exemptions are acquired or at the airport. So you have to go to customs to declare Each piece that you're taking out, there are forms that you have to fill out. You pay for the exemption to export and re-import.
Reinforce. If not, they
Yes,
will confiscate it.
right. If not, they can hold on to our equipment, value it, and you have to go through a whole lot or pay exorbitant amounts to clear. So that is also
Right,
key
that's
in
true.
traveling. We have to declare our equipment at customs.
And another
Uh,
thing, sorry, Kieran, is that the equipment is not known to anybody else unless they are members of their association.
Yes, that is a rule that we have at JASM. And we are encouraging or inviting their other associations and members of other associations on the platform. This is something that you would want to consider for your own association should you own equipment and not be traveling with your personal medical equipment. So acquiring equipment or modalities is also important. Carrie?
On that note as well, in terms of use of equipment, when traveling abroad, you may have teams, maybe smaller teams, not teams that are not as equipped as your team, borrowing your equipment. It is not safe to lend either.
Yes.
The reverse is also true. You could borrow a piece of equipment that is not calibrated and you burn a patient or something like that. So,
Yes. They noted. Duly noted. Thank you so much, Carrie.
yes, ma'am.
And we are set to jet. So we are moving right along
To another
and
destination.
to another destination. And when we travel and travel through time zones, oftentimes we run into the issue of jet lag. To present today on that topic, we have our very own Dr. Jodian Simpson, DPT, physiotherapist. Jodian Simpson holds a bachelor in physical therapy from the University of the West Indies, Mona. She has been practicing since 2012. She later received her doctorate in physical therapy degree from Nova Southeastern University in 2020. She has been an active member of the Jamaica Association of Sports Medicine since 2013 and has volunteered at various sporting events. She has traveled with the national women's rugby and basketball teams and has represented Jamaica internationally at the 2022 Commonwealth Games in Birmingham. She enjoys traveling, having good laughs with friends, and she is the current education committee chair for the Jamaica Association of Sports Medicine. Without further ado, help me to welcome Dr. Jodian Simpson as she presents on the issue of jet lag and how to manage. Jodian, take it away.
Hi, good afternoon, everyone. Give me a second and let me try to get this presentation up. I can open it.
So
Am I still on there? Hold on.
you're still on. I'm just speaking as the pilot and cursor for the day. Are you ready?
Hold on.
we welcome you on board and we want you to sit back, relax, and enjoy the flight. Remember, we are at your service. We will be coming down the aisle momentarily.
Your presentation was up a while ago, you know, Jody.
I don't know.
Yes.
I can't. Give me a second. I can't see it. Hold on. All right. There is now. All right. Is it there now? Yes,
Yes,
there
it
we
is.
go.
You're back.
Yeah. All right. So, jet lag. How do we combat it? All right. So, my objectives this afternoon are for us all to understand what jet lag is and the pathophysiology of it, to be able to identify the symptoms of jet lag, as well as to be able to identify prevention strategies and factors that might affect these strategies. Of course, we are all familiar with the term jet lag, but do we really know, what it is and what it might entail? It is something that athletes and frequent travelers speak of. And basically, it is caused by a disruption in the body's normal circadian rhythm. And they can end up in difficulties adapting to these time zones. And it can result in them having poor sleep, daytime fatigue, and it just impacts their overall health and performance, right? So the disruption in the circadian rhythm comes again because of the change in the time zone. And this rhythm is basically our internal clock, what we do within 24 hours on a regular. So our body maps it, and it is regulated by our hypothalamus in the brain, and it allows for us to map at what time we go to sleep, what time melatonin secretion stops for us to wake up, at what time our blood pressure is the highest, things like that. At what time we decide that we would probably want to go to the bathroom. It maps a lot of things that we do in a 24-hour span, right? So what happens is that we get light input from the eyes. It's transmitted to our pineal gland in the hypothalamus. And then that allows for the secretion of the hormone melatonin, which then plays a vital role in, our sleeping patterns, right? So the internal clock now then regulates the cycle of alertness and sleepiness by responding to the light changes in our environment, right? So the pathophysiology of jet lag happens when now there's a disruption of this rhythm. We have crossed time zones and now this rhythm has changed. We are no longer in a space where it should be day and we should be awake. Now it's time to go to bed, but we are not sleeping. So there's a misalignment between the biological clock and the cues. So the external cues include light and dark cycles, as I explained before, and sometimes it takes time for the resynchronization to happen. So that's for us, the time for us to adjust to the new time zone that we are in. Now, there are some symptoms of jet lag that we might be familiar with. And these are general malaise and headaches, insomnia, and fatigue that can significantly impact our daily activities. Lethargy and apathy reduce our overall motivation. Dizziness and some gastrointestinal distress can occur. And also just general declines in mental and physical tasks, just based on how we're feeling, depending on the time zone that we're in, especially if it has been across many time zones and we're having difficulty adjusting. Now, there are some factors that we have to take into consideration when we're trying to adjust, right? So as I mentioned before, the number of time zones that we cross is very important. So the greater number of time zones that we cross, the longer it takes for us to resynchronize or try to get back in tune with the time zone that we're in. It takes approximately 1 day per time zone that we cross to resynchronize, right? So that's one factor that we have to consider. Now, we also have to consider the direction of the flight. Now, traveling from east to west is, according to studies, 30 to 50% less time to resynchronize compared to when traveling from west to east. Now, the body's circadian rhythm or normal rhythm is within a 24-hour span. So it's easier to adjust the conditions that lengthen the day as opposed to shorten the day, right? So traveling from Jamaica to the UK, we will have difficulty readjusting because we've crossed the time zone now and we're into another day, shortening the time period that we would have had our 24-hour clock in, right? There is also individual variations that we have to consider. Some of us are late nighters. I know a few people, they are more awake at night. And while some of us are, that time, that's 8 o'clock, we are going to bed, regardless of what's happening around us, right? So the persons who are more alert in the night, then their peaks in the circadian rhythm are higher in the day. So they adjust to advanced phases, meaning if you're traveling from west to east. So they would adjust easier traveling from Jamaica to the UK, right? As opposed to the day persons who they're more alert in the day and it's their bedtime at 8 p.m. because they're going to get up earlier. Then they will adjust easier when traveling from east to west, right? So persons traveling from east to west, they would be going to their bed later. So it's easier for them to adjust in that direction, and persons traveling from west to east would be going to bed early. And that's why you have the difference between the persons who are more alert in the day versus in the night, right? There's also the factor of age. Older athletes favor adjustments traveling in an eastern direction because they like to get up early, like my grandmother is a very early riser. And, young people, it's different. So older persons, athletes, it's easier for them to resynchronize traveling in an eastern direction as opposed to the other way around. The other factor is also the exposure to sunlight in a new environment. Now, when you're exposed to sunlight, it helps, the earlier you are exposed to sunlight, it helps to adjust the circadian rhythm. So remember how it works is that they get the body gets the cue from the eyes as it relates to the lighting, and then that would help to, adjust the cycle. So factors, the exposure to sunlight in the new environment is a factor to consider. And there are other factors like diet. So the types of meals that we eat, whether it be heavy or light at the time that we eat them, would be a factor, as well as drugs and medication that we would take. So you have a set of drugs known as chronobiotic drugs. And for example, it's melatonin is one of them that helps to stimulate hormones to affect sleep or to keep you awake, right? So those are other factors that can be considered. Now, in order to prevent jet lag, there are some things that we can do, right? We can try to adjust our sleep schedule before traveling to the destination. And of course, the using light exposure in the new time zone, timed melatonin intake to aid in the phase shifting, so to advance the phase. Combined sleep. You are now in a time zone where it is daytime when you are used to it being night at that time, then you would want to ensure that you are managing the light, getting exposure to the sunlight, as opposed if it was the other way around and you wouldn't want to be exposed to a lot of light. So you would be able to sleep in the time zone at night, right? So generally, effective planning reduces the severity of the jet lag significantly in cases, right? So in order to minimize effects, it's dependent on, again, the time zones that we travel across. So for small time shifts, schedule competitions in the morning after westward flights is one way in minimizing the effects for athletes. Also, evening competitions are better after eastward flights. Traveling in one direction for extended trips is important, and also ensuring, again, the sunlight exposure immediately upon arrival. You also want to ensure that you engage in social and exercise activities, usually as soon as you're on the ground, checked into your hotel, you want to try and get some activity in at that point in time. For large shifts, for greater than 4 to 5 time zones, the destination arrival recommended is at least 1 day earlier for each time zone crossed. Also, you want to try to attempt to resynchronize the body to the time zone that you're going in before departing your country, right? Again, the emphasis is on sunlight exposure on arrival. And also, we want to avoid alcohol during flights because this can lead to dehydration, and then it can affect the function of the body going forward and affecting resynchronization, right? Melatonin use may also be appropriate, as well as the use of caffeine. So the practical guidelines in summary: 1, adjust sleep schedule to match destination time. 2, use caffeine to maintain alertness during the daytime. Take hypnotics like well, this is an example of which one, for insomnia. 4, avoid alcohol consumption during the flight. And 5, implement strategies consistently for best results. Now, this is a table of adaptation strategies based on the length of stay in the time zone. So if you're going to stay for 5 days or more, and the number of times cross is 3 to 5, then the recommended strategy is 1, pre-travel adaptation of sleep schedule, timed light exposure or avoidance, depending on the time zone that you're in, and timed melatonin intake. You want to take the melatonin at least 5 hours before you actually normally go to sleep. Intermediate length of stay, which is 3 to 4 days, and the number of time zones crossed is 2 to 3, then you want to work around sleep and alertness time. So schedule critical activity in the daytime, in the departure zone, airplane light exposure / avoidance strategy. If it is a shorter length of stay, 1 to 2 days, and the number of time zone crossed is minimal, 1 to 2, then you have short-term measures that can be used like caffeine, naps, and short-acting hypnotics for those who have insomnia. So in conclusion, managing jet lag is crucial for travelers/athletes' health. And the key factors include time zones and flight direction. So we always have to take that into consideration when traveling, before traveling. Effective strategies involve sleep, light, and melatonin. So remember why the light exposure or avoidance is important. And there is proper management. Proper management enhances performance and well-being. So once we plan accordingly and we manage well, then we would be able to, avoid symptoms of jet lag. Right. So now I will open the floor for any questions and discussion.
So we have one question from Dr. Diallo Brown. He's asking if the team arrives in the night, though it may be daytime or evening time in the team standard time zone, should they still do light exercise or go ahead and sleep first?
Well, within that time, the sleep cycle is recommended. So if it is night where they are, then it is recommended that they go to sleep. I think that's the question, right?
Yes, that's the question. And also, if you can, when traveling with the team, as Dr. Simpson mentioned, sleep scheduling. So where you're heading to, if you have a very long flight, sleep according to your destination schedule. So you might leave west in daylight or evening, but you know that where you're heading, it is now night. What I usually advise athletes to do is once you hit or settled in flight, sleep, because it's nighttime where you're heading. And then I usually do a schedule to wake them up when it's daytime where we are heading. So
Right.
sleep scheduling is also important. So it's very interesting. East to west travel and exposure to sunlight and age. I was ticking off how many things against me and my regular sleep schedule.
But you're a nice person, so.
Yes. So of course, we must know our sleep schedule and organize our phase shifting. Yes. Sleep in the time zone in which you're heading. Also, no alcohol in flight. Remain hydrated. That works. That really, really works. So I'd recommend that we try to practice that or try to be up to guide or have the talk with the athletes with whom you and team members with whom you're traveling to schedule sleep, food, the hydration you said, Dr. Simpson.
Yes.
And of course, we must know our age. Bleaching might be a thing of the past. So, you have to get it together when you're traveling with the team. Thank you so much. Are there any other questions? Okay, I'm not seeing any in the chat. And we are doing well with our schedule, just a little bit behind. And so we're going to jump right in with our roundtable discussion. Our moderators today will be Dr. Juliet Simpson, who was introduced previously, and Miss Terry Ann Brown, who is an affiliate member of the JASM and also serves, gives advice or serves as one of our legal consultants. And they will be moderating the roundtable talk. In our guests at the table today, we have Miss Vanessa Wickham, who is a member of the Guyanese Sports Medicine Association. She is a physical therapist. She has a master's of science in sports and exercise medicine from the University of the West Indies. She has a bachelor's in physical therapy as well. She is a registered physiotherapist with over 7 years experience in adult and pediatric neuro, ortho, sports injury rehabilitation. She is employed with the Ministry of Health in Guyana and one of the supervisors at the National Sports Clinic in Guyana. She has represented the Guyanese Olympic Association and has been team physiotherapist at 2022 Commonwealth Games, CAC Games 2023, El Salvador. She has represented and been team physio at Commonwealth Youth Games, Pan Am Games, Carifta, and served her country also at the World Relays in the Bahamas. Her skill set is wide, encompassing both sports medicine and neuro and amputation. She has leadership skills in master classes, and she has done World Anti-Doping Association courses as well. She is published, and her research area was semi-professional and professional footballers' knowledge of and attitudes towards concussion. And this was published in the Journal of Sports and Health Science in 2023. We welcome her to the round table. We also have with us at the round table a physiotherapist from the Republic of Trinidad and Tobago. She's Dr. Vern Alain. She has been a physiotherapist for over 30 years. In 1994, she received her diploma in physical therapy from the University of the West Indies, Mona. In 2000, she earned a Master's of Health Science degree from the University of Illinois. In 2003, she received the certificate in healthcare management from Indiana University. And then she went back to the University of Illinois in Indiana and gained her doctorate in physical therapy. She has been lead physiotherapist in the orthopedic clinic and sports medicine clinic attached to the Indiana University School of Medicine. She also holds a certificate in podorthotics and lifestyle disease management. Her skill sets include topics in personal training, active release, dry needling, and manipulation. She's the current managing director of Excel Physical Therapy in Trinidad and Tobago. Dr. Alain has volunteered with the National Athletics Association in Trinidad and with the Trinidad and Tobago Olympic Committee, and has been part of their medical team for quite a number of years. She has represented locally, regionally at World Championships, the Commonwealth Games, Pan Am Games, IAF World Championships, and the Olympic Games. We welcome her to the panel as well. No stranger to us is our very own Dr. Gwyn Jones, renowned orthopedic consultant. He has been a past president of the JASM. He's a consultant orthopedic surgeon at Mandeville Regional Hospital. He's an associate lecturer of the Faculty of Medicine, Department of Surgery, Radiology, Anesthesia, and Intensive Care at the University of the West Indies. He's the chairman of the Therapeutic Use Exemption Committee of the Jamaica Anti-Doping Commission and a member of the Usain Bolt Foundation. His contribution to sporting events include locally champs, knockout championships, Carifta Game, World Championships, World Juniors, IFNA Netball World Championships, IAF Junior Games, the Olympics, Pan Am Games, you name it. He has been there, and he sits on the panel this evening, a thorn between two roses, and we welcome them. I will now hand over to our moderators for them to engage us in discussing the medical team composition, their roles and accreditation at games and meets, their experiences traveling with teams, and some pointers, if any, they can share with us.
Welcome to all the speakers. Everyone is here and hearing me?
Yes, thank you.
All right, so I have the first scenario that we can discuss. So on recommendations for number of personnel made by World Athletics, IOC, and other international federations organizing committees, practically solo clinicians, HCPs on traveling teams is not ideal. Accreditation limits access to certain areas or accessing medical stations depending on whether you are a licensed HCP or not. For example, doping center, call room, ability to accompany athletes for medical intervention. Now, the scenario, what happens if someone is sick at the village and that there's one HCP at the competition area? Would you like me to go over it or?
Yeah, I'm not sure.
So basically, based on the recommendations, the accreditation limits access for different persons in certain areas. Now, so whether it be doping center or the call room or the ability to accompany athletes for medical intervention. Now, what happens if someone is sick at the village and there is one HCP and the person is at the competition area? How we approach that situation?
If I may, this is Vern Allen. This is Dr. Allen, physiotherapist from Trinidad and Tobago.
Hi, Dr. Allen.
So if I may contribute here, the first thing is the response will depend on the level of the game. So if it's the Olympic game, for example, then that's a different scenario because there is good medical support at the village itself. So there is a polyclinic at the village. The same thing obtains with the Commonwealth Games. But once we're looking at CAC games and all the other games, then that's where it becomes really tricky because there is not necessarily a full-blown clinic at the village setting. So I think the response will be dependent on the level of game that we're at. You know, whether it's Carifta Games, whether it's Pan Am Games, CAC Games, the level of care at the Games Village all depends. So that's the first thing we have to understand. And when I say the level of care, I mean the level of care provided by the organization or the organizers. It varies with the games.
Okay, thank you so much. You're hearing me clearly?
Yes.
Yeah, we are.
So, as you mentioned, the size, sorry, no, as you mentioned, the size, or well, the type of game it is, the type of event that it is would require, well, would determine the size and the scope of the healthcare team, yes?
Yes,
Right?
correct.
That's also determined by the local, the availability of other facilities and personnel, funding, and the number of athletes to be cared for. We know that a medical team is a group of health professionals whose major responsibilities includes health and safety of the athletes, and of course, sometimes it will require them to also care for other persons who are not the athletes, but who would have accompanied the athletes to the event. Right? Usually teams have a primary care team and a secondary care team. And when they attend events, we may be limited, or the teams may be limited to who exactly they can bring and whether they have the money also or the funding to bring persons. The three persons here that we have as guests on this panel, do you have an opinion as it relates to I don't want to say the importance, but if you could prioritize a couple of the medical specialties or allied health professionals on the team that would accompany a team. Is there a specific category or priority that you have them in your mind? Do you understand what I'm saying? For example, the primary care team includes the medical physician, coaching staff, physiotherapists, and admin. But then you have other medical specialists, such as cardiologists, general surgeon, dentists, and then other health professionals, nutritionists, massage therapists, mental health person, chiropractor. Do you guys have a priority list that you would say is best to bring all the time, like your top 5 or your top 10, for example, if you could?
Hi, this is Vanessa Wickham from Guyana. Thank you for the invite. So when it comes to the Guyana Olympic Association, the first person on the list is the physiotherapist. If they can, a doctor comes along, but that depends on the size of the team. We have never traveled with a massage therapist before because our teams, the number of athletes that we usually go, it's still small. Yeah. So basically, it's a physiotherapist and in some cases a doctor, but we're working on, getting to that place where we travel with a massage therapist. Hello?
Yes. Dr. Jones, any opinions as it relates to critical persons?
All right, so that will depend on the size of the team and I guess the type of teams. Carry and different persons had alluded to it during their presentations. I was talking to Piran earlier, and like for the rugby team and so forth, for teams where you might have a risk of head injury, rugby, boxing, etc., football, you can have a sudden event and things. You definitely need to have a medical doctor there with the right stuff with the right training and so forth to see if somebody's life becomes necessary. And then you can adjust it from there. Massage therapists and so forth would come in when I guess mostly for athletics, where it's a critical part of the preparation of most of the athletes now in terms of being massaged before and after they compete. So it depends. It varies and it depends, and hence why it is good to choose your personnel way in advance so they can organize and recommend who travels with the team. What's happening now, especially after the senior athletes, is that they're requesting the presence of a chiropractor. Chiropractors are not like primary persons in a lot of teams, but for track and field, a lot of the senior athletes are requesting chiropractic care. And some of them have connections with some of them who have good endorsements and stuff, where have chiropractors who come from like the company might fly them there and then they use them accordingly. So yeah, it varies. No hard and fast, but it depends on, like I say, your team size and the sport that is involved to how you'll decide, and then that should be determined from well in advance and not at short notice when you end up scuffling around and probably ending up short in terms of the type of persons that you have on the team.
Okay, I understand what you all are saying as it relates to it. It also somewhat depends on what sports you would have to be in charge of. When we think of a big event, for example, like the Olympics, right? And that it is multifaceted, or that there are a number of sports going on at the same time. They may be happening at different locations, right? How I know that in the past, the team usually feels short-staffed, for example, when it comes to how many medical practitioners or how many persons are there. Do you have any advice as it relates to how to handle multiple athletes, multiple events, and multiple locations, as for example, the sole or one of two medical aid personnel on the team?
All right, so
If
one.
if I may, there are several things that can happen with the medical team depending on the size. So at the Olympic level, we have the case where athletes would want to bring in their own handlers. So the the medical team, the massage therapist, the chiropractor, the physiotherapist that have been working with them at the Diamond League level and has been working with them. Sometimes they have their preference for their persons and they bring them along to work with them. And that's the athlete's right to do so. Now, if it's a big team, what we would do, we will split up our medical team. So we will have a running clinic. Let's say we have a big 200 or 300 person team or 100 and something persons on the team. We will have a clinic, a base clinic that is manned by a physiotherapist and sometimes a doctor, all, within working hours, let's say from 7 o'clock in the morning to 10 o'clock at night. And then you have other therapists going out to the games, going out to the track, going out to the competition sites. And if an event happens, then they get treated or seen by the therapist outside, and then they could be sent inside the clinic, so to speak, for continued care. So it really depends on the size, whether or not the person have their own medical team support with them, and whether or not the athlete, because the athlete sometimes would say, I don't want care, or I don't want this kind of care. So you have to allow the athlete to make their decision too, to take advantage or not take advantage of what you have to offer. So it varies.
So here's where deciding on your medical team from early comes into play. So what we tend to do, especially for multi-sport events like Pan Am, CSC, and the Olympics, is one, get maps of those event sites. So you know exactly where the different places are, where different sports are going to take place, and the time it takes to get between one venue and the next. So therefore, and in the time of each event, so you can know whether the same person can cover two events in the same day, or will not be possible. When we had CSC games one time in Mexico, the track and field and table tennis and badminton were like 2 hours and change away at altitude at a different venue from the other sports, squash, cycling, and other things like that. And then we had to divide, make sure the appropriate doctors were at the appropriate venues, especially that will depend on the doctor's background. You might want somebody who has a background in like orthopedics or something like that to be a place where you'd tend to have a lot of physical injuries that they would probably best be able to deal with. And then based on that, you print out the types of the sports, the venues and so forth, and the timing, and you look at how physically best it is you're able to divide your personnel amongst the different sites. And that can take place from well in advance, from 3 months out. You can decide on how, and then the numbers of persons you will need, what type of skill sets you're looking at, and how best you're able to cover the event. When you have short notice selection, that's what I think that usually becomes an issue, and sometimes you might end up with persons some events not being adequately covered because you didn't have enough time to ensure that you had enough persons who are chosen to travel and the appropriate skill sets, and then that becomes an issue.
Thank you. And one other thing that prevents effective coverage, I suppose, of your medical team would be accreditation, because for some events, I believe that personnel are restricted as it relates to where they can go. We've had issues, I'm sure, with accreditation and proper passes being allocated to the personnel. What is something that we can do in situations like that, or have you ever faced such issues whilst working with a team or working at an event? So that's a question on access.
Well, I personally have never had an issue with accreditation, so to speak, because usually the physiotherapists are given accreditation for all the events that we have representations for. In cases where we have very large teams, the physiotherapists and the medical doctors are given infinity access, so we can access any event, so to speak. So I have never had an issue with access, and if an issue of access becomes up, then we can always consult with the chef, and she or he can always change the access, the passes, so that we can get to see the athletes as necessary.
I have never had an issue with accreditation too. What happens usually, you receive your accreditation at the games. So when I get there, if there's a question or a particular concern I have, I would raise it with the chef de mission and, get it sorted out. But for all the games I've attended, there was no issue in gaining access to certain areas, even at the track if we needed to enter the polyclinic or the medical setup for there was no issue or problem.
Again, access has a lot to do with the administrative stuff. We don't have any control per se initially in going. We try to let the persons know who are like the chef, the mission, and the other technical persons involved know, but they should be familiar with the areas that they need that medical access to. Usually if something comes up, then the relevant persons are alerted, and then you can and then they can go and ensure that appropriate access is obtained. I mean, I've been in a situation where some access was being denied by the local organizing body, which was ridiculous and didn't really make much sense. And at a point, was about to jump a fence for an athlete who had collapsed on the ground when nobody was attending to him. So sometimes we can't go and dictate where we want access to. That is usually comes from above. We can request, but it usually has to be done through the various technical persons and heads of delegations that are organizing these things. And that's where it was. But I've been somewhere where they were preventing access to the track, and when I heard that who went down, and nobody was attending to him. Nobody. So pretty much had to jump the fence and go over there and then deal with the consequences afterwards, which wasn't anything in the end. So that's that can happen.
We have a comment from the audience.
Yeah, this is Pat Luchin. The number of medical personnel who goes to the different games also depends. It becomes a little complicated when you have teams. So, for instance, at one Commonwealth Games, there was a cricket team and there was a netball team. Now, when you look at that, there should be at least one physiotherapist per team, plus other physiotherapists deployed for the other sections. You had swimming, suppose if you had badminton, and if you had another team sport. The ideal would be to have one physiotherapist and or a doctor for each team. That's where it becomes complicated. So if the local, the NOC does not recognize all of that and make preparations to have the proper number of people on the medical team, then that becomes a bother when you get there. And most times morning training, evening is competition. Then you have to think about treatment. Usually a physiotherapist will stay back in the village for the morning session. One goes to this training session, one stays back, and whoever the athletes that are in the village will get treatment. Then everybody goes to competition. When you come back after competition now, 10 o'clock till whatever time in the morning, you're teaching again. So if you have 1 or 2 therapists for 30 odd people and 60 odd people, how can you manage? It's a difficult scenario, but then the organizers have to really decide if they want good medical assistance when the athletes go, and therefore we don't have all these injuries and all these upsets and different things that you see, with the press doing this and coaches saying that and all that. It boils down to the fact that we don't make proper preparation in a timely fashion to prevent all of these.
All right. And what about wrong credentialing? I heard in the last Olympics, some African nations accrediting persons falsely as medical personnel. Has anyone ever had such experience? For example, meeting persons who you thought were MDs or PTs and they were otherwise profession?
I have not met anybody who with appropriate accreditation who was not, well, suppose they are not they are appropriately qualified. Not to say that they might have pulled the wool over my eyes, but yeah, most people that I've met who have been so that have the accreditation for the position have been qualified for it. Have many other persons who are working on the false accreditation.
All right.
I don't know. From my physiotherapist point of view or vision or lens, I have met a few physiotherapists that were not physiotherapists. So when once you start talking to them, they will tell you that they are not physiotherapists. One of the things that Trinidad and Tobago Olympic Committee decided a long time ago, and this was a suggestion made by Carriel DeBeek, one of my colleagues, is we used to accredit persons, massage therapists, and other professionals as physiotherapists. And she did alert the TTOC about that practice. And unfortunately, yes, it still happens in other countries because, sometimes I would have introduced myself and say, hi, I'm a physiotherapist, and they say no, they're wearing the credential physiotherapist, and in talking to them say, no, I'm not really a physiotherapist. I'm a massage therapist, or I'm an osteopath, or I'm a something else. So I or a chiropractor, or so in our sphere it does happen. So what they have done is everybody is credential, at least at this Olympic was credential as medical official to move away from somebody who is not a physiotherapist calling themselves a physiotherapist, because unfortunately what happens after the Olympic Games, the person still markets themselves as physiotherapists. So I have seen it.
Okay. So let's talk about the pressure to return to play that some athletes may feel. As the medical team, you guys have a responsibility per se, or there may be high expectations for you to get the athletes in a good position or in a good, right, well, at a good or great level to perform. What have you ever experienced, I suppose, have you ever experienced athletes or coaches that won't per se listen to your advice or listen to your recommendation as it relates to that athlete returning, or an athlete returning to play after injury, or where you've identified some risks? And how do we deal with that?
So I have never had that experience. I think one of the important things to establish is that if you work with a team, for example, I work closely with athletics. So I know the coaches. So we have built a relationship and they trust me. So if I say to them, well, this athlete is not ready, or, we need 3 more weeks, they listen. So I've never had that experience, but I think it's pretty difficult when you don't have a close relationship with a coach, or you don't have like that team dynamics going, and you say to the athletes or you say to the coach you're not ready, and then they still push the athletes. And it also involves you being able to sit down with the coach and the athlete and explain everything in detail, the pros, the cons, just lay it out on the table, sometimes in layman's terms for them to understand, so that, we're all on the same page and that it's a group decision also, right? Because I think if there are cases in which you just make the decision as a therapist and they still go ahead, it can be detrimental. So it really has to be like a group decision. And when it's an athlete who's young, when it's a child or so, the parents also need to be involved. But thankfully, I have never met that sort of resistance or that sort of problem with any of the athletes that I work closely with.
Yeah, just agree with Miss Wickham there. So I agree. This is always a group decision. And remember, as medical personnel, we're really there for our opinions on situations. In the end, between the athlete, the coaches, and management, they'll decide whether if they're going to compete or not. Generally, what I've found is that you won't get much resistance from the athletes and athletes camp if you suggest don't compete. But I find sometimes if you say that they can compete, and you might have other coaches or people in other camps, especially at places like the World Championships where money is involved, you'll have people who might perceive that an athlete from another camp is injured, and as a result, they should not be participating. They could get their athlete in to compete, and as a result, that would mean more money for their particular program. So I've been in situations where I said I figured it was okay for myself and the physio, said it was okay for the an athlete to compete, and then received various challenges and confrontations, but from people from other camps. Some were from the coaches, from some other athletes who were like next in line. Some were from people who were part of the management team of that particular camp. And in a situation like that now, you have to, I mean, like I said, the decision is, I mean, Speaker was saying the decision is a group thing. And then you lead on your opinion, and the final decision will be made between the athlete and the coaches and so on. But you get resistance sometimes from people from other camps who might want their athlete to get the spot of the athlete that you have okay to compete. And then that sometimes can lead to various back and forths and other issues.
Okay. We're wrapping up now. Are there any questions from the audience?
If I may, I think the bigger the team, the more likely they are for conflicts, because especially where individual sports is concerned, because you always have competitions between clubs and different persons vying for spots. So once a team starts to get bigger, the dynamic gets, in terms of deciding whether or not an athlete should compete, it gets tougher. I have been in difficult situations at before, and basically what I would have done was to recommend, based on an ultrasound report, I made a recommendation. Look, this is what the ultrasound says at this time. We have a large hematoma. This person is a young person. You know, if the person competes, you know, they're more likely to make this injury worse, and leave it up to them. Tell them the pros, the cons, what they're dealing with, and leave it to them to make the final decision. And sometimes it's not, you wouldn't be the most popular person, but you just have to tell them the truth, the reality of what you're dealing with. If we're looking at a young athlete facing a professional career, you can, you know, let them know that, you know, if you do this race right now, there's a likelihood you will worsen your injury, and the possibility of signing that contract could be deferred for another year or two. So sometimes you have to make some hard calls, but you know, you, at the end of the day, the coach and the athletes and everybody is, they have they should be involved, and you know, hopefully agree with your decision.
This is Pat Luchin. What is your team's protocol in terms of who goes with the doping control once they're called?
Please repeat.
What is your team's protocol with respect to being at doping control when your athletes are called? Who goes? Is it the medical team first? What is the protocol? You know, is it the coaches first or the medical team first? What is your protocol when your athletes are called for doping control?
I don't know if there's any protocol per se, you know, because what I've seen a lot of times it's good when somebody with a medical team goes, but sometimes athletes want their agents with them, or somebody who's a part of their own personal medical team. The general thing with I've seen, like with the J3s, is that they usually like somebody medical to go, but I've been en route to doping with an athlete, and the agent or somebody is with them and wants to go with them. So it doesn't, there's no hard and fast. I mean, everybody's just a time to chaperone, but the person does not necessarily have to be medical. You know, that's not a requirement by WADA or the local anti-doping agencies. So it depends on whatever the athlete is comfortable. Ideally, it's good to have somebody who has a knowledge of doping control, who can advise the athlete and make sure the athlete puts on or enters the right information into on the forms, and you know, in terms of their drinking and their urine passage and so forth, to make sure that all the various things are done appropriately. That's why it's good to have somebody who knows about it. But that person doesn't necessarily have to be medical. I don't think that there's no hardcore protocol, I think, as to who goes.
I have been in doping control, and all 4 persons in the relay were taken for doping control. So you have 4 people down there, 1 person. And then what happened is, after the first person went in, we turned around and I said, it's just me alone. So, okay, I will stay. So the other athletes stayed, and then we just got through all 4 eventually. But, you know, it can get difficult like that sometimes. And then also, you must be aware that when you can see when the doping control officer goes to the athlete, you look out for the athlete. when the doping control person goes, then you know, okay, within the next whatever hour, I don't know what the new protocol is. Then you're gonna have to go down to the room. So you find yourself down there. I don't know if now we used to have passes, special passes for doping. So you will probably have one from you go down to competition. You know, you have one for the next athlete that's being called. Then you go and then you just give somebody else doping control pass to go. And that's how we used to work it. But I'm not sure what the thing is now. But you just be aware that if you know you're going, you just watch out for the officer going to your athlete. And the next thing you know, you just find yourself down to the area and be available when you're being taken to the room.
Okay, we want to thank everyone for participating. Wrapping up, summarizing the roundtable talk, thanks to all the panelists. Take home message, there is no I in team. Clinicians must be able to adapt and fit into the team chemistry. To avoid conflict, then all members of the medical team should know their functions, roles, and scopes of practice. The medical team at all times should bear in mind that the primary responsibility is the athlete. The medical team should encourage, I'll put it as cross-pollination of ideas. So you're working as a team, different medical disciplines, all are part of one body, and you give everybody a hearing or a chance to discuss or effectively communicate with each other, to communicate with the athlete, to communicate with the coaching staff. And this all blends and gels and becomes a cornerstone of a successful medical team. We are hearing early notification or adequate notification about teams, about team members, so that the medical team can be adequately prepared to answer the needs of both the athletes and the entourage that supports our team. I want to thank you all for being with us this evening. I hope you were well informed and have new ideas, new information to take away that will help you in the practice of sports medicine, new informations that will help guide your associations. And we look for more Caribbean sports medicine associations to come into play or to be formed, and all its members actively participate in the care, development, safeguarding, and well-being of our athletes. Thank you so much for being with us this evening. Our presenters have left their information in the chat. I hope you have written it down. For those persons who the CME's certification is free for JSM members in good standing. For non-members and JASM members not in good standing, there is a cost of $1,000 for certificates and CEUs. We do have access to our Zoom and YouTube channels to verify. We ask that you make direct transfers to our association. Banking details are in the chat. And please send proof of payment directly to the Education Committee's email at jsmeducation@gmail.com, and copy, if possible, to jamaicasportsmed@gmail.com. All members in good standing should receive their certificates through email. I will just plug in as treasurer for the JASM that dues are due. We are now in August, and from our last AGM or BGM, it was changed. Dues are to be paid the start of each year. So if you haven't done so already for this year, it would mean that you're not in good standing, except for those persons who paid for 2 years upfront. I am available or you can contact jasmsportsmed@gmail.com to find out about your membership status. We have completed the JSM Constitution review, and all members will receive a copy of the Constitution that was ratified last November in short order. In other news, we have JSM conference coming up in November, and we hope to get that off and have you all in attendance. You will hear more about this. From the CCJASM news desk, or PHE, periodic health evaluation session will go on in September. We're asking members to volunteer to help us with screening of our high school athletes. You can get more details also via email if you would love to be a member that assists in this event. We thank you so much again for being with us this afternoon. Do enjoy the rest of your Sunday.